Hello and welcome to Anaesthesia Skills Simplified with Dr. Rishabh Gautam. Let's make anesthesia safer, simpler and smart. Sellick's maneuver or cricoid pressure. It is a pressure given over the cricoid cartilage against the cervical vertebra to reduce the risk of pulmonary aspiration. It is being given during rapid sequence induction and intubation. Why the Sellick's maneuver is given over cricoid cartilage? It is given over cricoid cartilage because cricoid cartilage is the only cartilage in the airway which is completely circular and it encircles the airway completely. It is a C-shaped cartilage. Now, how to identify the cricoid cartilage? Cricoid cartilage is situated below the thyroid cartilage. You can identify it below the Adam's apple and you can palpate it as a circular cartilage. Technique of Sellick's maneuver. To give the Sellick's maneuver, first of all identify the cricoid cartilage. It is situated below Adam's apple. Once you identify and palpate the cricoid cartilage, put your thumb and index finger or thumb or middle finger over the cricoid cartilage. Then you have to give a backward pressure, not upward, not any sideways pressure. You have to give the backward pressure towards the spine against the cervical vertebra. You have to give backward pressure. And remember, if you are not putting your hands on the right place or you are not giving the pressure in the right direction, then you may result in difficult laryngoscopy. So remember, the direction of pressure is backward pressure. How much pressure to be given? The pressure to be given is, in the awake situation, it's 10 newtons, and as soon as patient loses his consciousness, increase the pressure to 30 newtons. So when to start and when to end the cricoid pressure, it is very important. You have to understand this thing. You should start giving the cricoid pressure once you have started giving the inducing agent. In the awake situation, we started. In fact, before giving the induction agent, put your hands and give a 10 newtons pressure. Why we are talking in awake situations you should give 10 newtons pressure? Because in awake situation, if you are giving too much pressure, then it will become uncomfortable for a patient. Then as soon as patient loses his consciousness, increase the pressure to 30 newtons. Remember, you have to maintain this pressure until the intubation is done, cuff is inflated and tube is confirmedly inside the trachea. When you have confirmed the location of the tube and you have inflated the cuff, then only you have to release the pressure. What could be the adverse effects? The risks involved with the cricoid pressure are: number 1, difficult laryngoscopy, and number 2, in few cases when the patient is having a forceful regurgitation, then in those cases it may lead to the rupture of esophagus. You should remember this thing. If you feel difficult laryngoscopy, immediately release the pressure, and in case of forceful vomiting, forceful regurgitation, immediately release the pressure, as it may lead to esophageal rupture. Cricoid pressure is a very important part of RSI, and you should always learn this technique. But you should also remember, the greater risk in RSI is not the pulmonary aspiration, it is the not able to intubate. So immediately release the cricoid pressure if you feel difficult laryngoscopy, if the patient is desaturating during laryngoscopy, and if there is a forceful regurgitation, forceful vomiting. Thank you.